This is Pathways to Prevention, the podcast that sparks conversations shaping the future of drug prevention and recovery. Powered by the Drug-Free America Foundation, we bring together leading voices like policymakers, researchers, faith leaders, prevention experts, and real-world changemakers to tackle the biggest challenges in the fight against substance misuse. From breaking trends to innovative strategies, we explore what works, what's next, and how we can all make an impact. You're here because you care about creating a world free from the grip of addiction. Together, we'll uncover the stories, solutions, and strategies that drive meaningful change. Thank you for listening. Now, let's get started.
All right, welcome back to the Pathways to Prevention podcast, where we explore innovative strategies, inspiring stories, and proven practices that empower communities to prevent substance misuse and to promote healthy choices. I'm your host, Dave Closson, and today's episode is a special one. But before we start the show, I want to tell you about the 12th Annual National Prevention Summit, February 17th and 18th in St. Petersburg, Florida. The summit will concentrate on the effective implementation of prevention and recovery strategies. And it'll also provide communities with the tools needed to advocate for sound drug policies. This year, the training sessions will feature 3 specialized tracks: the impacts of marijuana use, a recovery track, and drug demand reduction, diverse perspectives track. Now, registration is open, so check the show notes for the link or visit dfaf.org. So for today's episode, we're joined by Angie Ferguson, the Executive Director of Drug-Free Clubs of America, a truly groundbreaking organization with a unique approach to prevention. They reward students who volunteer to remain drug-free, giving them a built-in excuse to say no to drugs and celebrating their commitment to healthy living. Angie's journey started in a firehouse, where a heartfelt conversation with her dad and fellow firefighter sparked an idea that would change countless lives. And since then, Angie's not only helped grow Drug-Free Clubs of America into a thriving program, but has also become a passionate advocate for sustainable prevention practices. In today's conversation, we're going to hear the story behind Drug-Free Club of America's creation, the transformative impact it's had on students, and their vision for the future of prevention. So whether you're a parent, an educator, or prevention professional, this episode will leave you inspired by what's possible when we focus on recognizing and supporting positive choices. So let's dive right in and hear Angie's story on this episode of the Pathways to Prevention podcast. Now, without further ado, Angie, welcome to the show.
Well, thank you. It's so nice to be on here. I appreciate you inviting me.
I've been looking forward to it. And as I was researching and looking at the origin story, I was just drawn in, and I can't wait to really hear the behind the scenes of the origin of Drug-Free Clubs of America. And I wonder if you could take us back to that conversation at the firehouse with your dad and what really started this vision and how we kind of understood, like, this could really work. Can you take us back?
Yeah, sure. So it's ironic that you asked that, because that particular memory is one that, you know, when something significant happens in your life and you have what they call a flashbulb memory. Mm-hmm. For me, the moment that my dad and the other firefighter told me about the concept of what is now Drug-Free Clubs, I remember literally where I was standing in the firehouse. I remember, and I say this on our website when I explain a little bit about why I do what I do. I remember the coffee pot next to me. I remember how it smelled. I spent a lot of time at the firehouse growing up, but this one particular moment that stands out is after they explained the concept. At the time, I had a very close friend who we all knew was going down a pathway that we were very scared for her. And I remember thinking, wow, this could work for her. This could have worked for her if she would have had it as a prevention measure. And so it grabbed my heart in that moment. And that was in October of 2005. We've been plugging away at it ever since, to the point that I had a totally different career. And I always said, yeah, I'll help you get this off the ground as a part-time basis. And then it took over as a full-time basis. And then I got my degree in public administration. And then I became executive director. So over the course of 20 years, it has really evolved into something that has become so special.
Let's just unpack that a little bit. I teased out sort of the initial concept in the introduction for folks, but I wonder if you might kind of give us an overview of what y'all do, who y'all are.
The approach is extremely unique. Typically, when you think about drug prevention, you think about education in the classroom. You think about Red Ribbon Week activities, things along those lines. We do it very differently. The point that the firefighters had when they thought of this concept was that teenagers need a safety net. They need a way to deal with the actual moment they are being offered a substance. How do you have a program that has a presence in the moment of the offer? And that is where the concept of drug-free clubs of America really is rooted. So they figured out that drug testing works every single day in corporate America. It works for our pilots. It works for our bus drivers. It works for our police officers. It works for any number of people. My husband is with the plumbers union. So, they're all drug tested for workplace safety. Why couldn't that concept be applied as a prevention measure for teenagers? So that's where they started, is they realized if we can offer teenagers a test as a way to say, hey, I can't do that because I get tested, then they save their sort of social cred and they have an out at the same time. So they simply can't. And when I was explained this concept, it reminded me of when I was in high school and my parents would say, if somebody offers you a cigarette, just tell them that you're allergic and that you're out. So it's the same thing. It's a safety net for that moment. But they didn't want some of the pitfalls of drug testing that have been discovered through research, which is if it's mandatory, then the student isn't believing in it. It's not something they're standing up for. So let's not make it mandatory. If it has punishments associated with it, it's not positive. It's not reinforcing. It's not going to build a belief set that will survive after graduation. So let's make sure that it's something they believe in as something that's positive, not something that's punitive. So they really took the concept of drug testing, reimagined it as a prevention tool rather than an intervention or a punitive tool, and then gave the students this out. So schools do not get our drug test results. They go directly to parents. We have resources for parents when they do get a positive drug screen, and we have a school counselor on staff. She retired last year from 34 years in education, so she has follow-up conversations with parents as well. So we start with the drug test as an out in a way that's completely positive. And then we say to the students, okay, if you earn your active membership in drug-free clubs by passing your test, you get rewards. And those rewards are designed by student officers. They come up with ways that students are put on a pedestal in their school environment. Maybe they get to go to the front of the lunch line on Chicken Nugget Day, or there's Big Cookie Day where all the students in drug-free clubs, they show their ID card and they get the big cookie with lunch that the other kids don't get. Get out of class 5 minutes early to get your car out of the parking lot. We call that beat the rush. All of these things that students have come up with. So it's truly peer-led. And then out in the community, we want to be sure to engage the entire community around a student. So when they're at the local restaurant or a laser tag or a car wash, they have discounts and rewards in their community as well, simply by showing their ID card through arrangements that are made with those business owners. So all positive reinforcement and out when it's needed and led by their fellow peers. And that's really sort of the secret sauce.
Yes. And in my summary of it would be that the power of the out at the moment of the ask, which you took me back to when I was 17, 18 years old, and I didn't realize that I use that same approach of having a pre-planned out in that, I'm in the Army, because I enlisted when I was 17 going on 18 as
good for you.
junior in high school. And so, so I get it. That's powerful. That's powerful. But then with the perk of membership, I see that as making life without substances more desirable, cooler than life with substances kind of thing. Yeah.
100%. And it's refreshing to the community as well, because so often our businesses and our community leaders are approached on this topic simply from a perspective of finances and not necessarily from an engagement standpoint. So we really make it a point to have somebody that can communicate to each community where we have a club about what's going on inside of that school. Why are these students coming to you with this ID card? What does it mean that they earned it? They didn't just say they want to be drug-free and take advantage of the pizza party, but then, hang out with their buddies on the weekend and do some nasty stuff. No, instead, they have said, okay, I'm going to test drug-free. I'm going to do this as a choice, not as a mandate. And I'm going to stand up for what I believe in. It really helps with credentialing when students are going to look for jobs, especially if that community business has already heard about Drug-Free Clubs of America in their local schools. It helps with that. We've had students who have gotten scholarships when it was neck and neck with another student. That's what put them over the edge. We even had one student that told us that they got into Canada on their photo ID. They forgot their photo ID, but it had their full name and it had their picture, and that's how they got into Canada. You just never know. We do a scholarship contest every year, so that puts some money in the pockets of some of our students to make some of their educational dreams come true. There's just 100 ways that it shows up in a family's life and in a teen's life. And then when we follow up every month with education and awareness and special things that we want them to be aware of, it makes them more of an authority on the topic as well. So they can become that voice for maybe some of their friends who might be making risky choices.
Prevention influencers.
Yes, that's what we aim for, right? It's one thing to get them in the door and say, okay, I'm so proud of you. But when you can actually use that position to multiply the influence in a positive direction, it's so powerful. It's so powerful.
Just takes me back to a quote from my friend and colleague, Dr. Jeff Linkenbach. And it's just, if you want health, you must promote health. That's what you're doing. You're promoting healthy, positive behaviors.
I fully agree to that. But it's interesting because as adults, and especially some adults in prevention, we kind of feel like we know what's best, or we have all of this education where like the framework says we have to do this, this, and this. And you know what? If the teenagers aren't saying that, it's going to look good on paper, but is it going to keep them drug-free when they are out of the high school building and they're making decisions for themselves in their young adulthood? We want to build something that is driven by the students, because otherwise we're just guessing at what we think is relevant when really they could come up with somebody that's completely off the wall and 1,000 times better.
Yes. And I know our audience, just based off of feedback from folks, really appreciate the positive approach, the promoting health and the youth driven work, programs, initiatives. So I'm guessing folks will be wanting to really lean and say, well, Angie, what were some of the challenges you faced early on in getting the organization up, like off the ground? What'd you run into, and how in the world did you overcome them?
That is a great topic, because honestly, the thing that has to keep you going in this work, and I'm sure that your audience knows this firsthand, as do you have to be passionate about it, because not everybody is. And especially in this day and age, you're swimming upstream against some big money out there. And so if you are coming from a place where you're half in it, then you're going to fizzle out pretty quickly. 20 years of doing this, and it still gets my heart excited when I think about new things that we're doing and opportunities we have, partnerships and collaborations like this one, great conversations. So at the end of the day, the passion has to be there, or especially the teenagers are going to pick up on that. They are emotional human beings that are trying to find their way and establish what they're about. Their passion is extremely important to them at this age. So if you're not passionate, they're going to pick up on that and kind of not think that you're in it for the right reason. That's not going to work. As far as the challenges that we faced, we're very fortunate with the funding model that we have. Our office space is donated to us. Our IT support is donated to us. We have a lot of donations for in-kind. So we're very fortunate in that way. Of course, funding is always an issue. It's one of the biggest things that our field faces, because as soon as something becomes available for a grant, maybe that fizzles out as legislative winds change or as topics become less relevant than something else. That's probably one of the biggest things. When we think about a time like the pandemic, as an administrator, it has never been more evident the importance of planning ahead. So you really have to think ahead and plan for emergencies. We were fortunately at a point in our finances where we were bringing in funds to pay for the following school year, which ended up being such a blessing, because when you talk about schools closing down and not being able to do the program, we had almost 2 years of very little income. So the fact that we were able to build up our reserves to that point, and the fact that we were willing to tap into them. Some people build it up and then they think, I can't possibly dwindle that. That's going to be a challenge. And then other people are so shoestring that they really don't have the opportunity to build up those reserves. So that's probably the biggest challenge, is coming up with a revenue stream that you can rely on, that isn't going to be just grant funding, that isn't going to be just, oh, I hope some money falls out of the sky. You've got to be creative about offering things that people want, and they're willing to pay for it so that you can stay sustainable.
It's almost like you're looking at my notes. Where my mind wants to go next is unpacking how the program or organization has sort of evolved over the past 20 years to meet the needs of students and, be a sustainable and effective organization. Like, how have y'all evolved and grown and changed?
I think probably the biggest key to that is paying attention to your metrics. Every year we do surveying, and I dive into those and really evaluate what is it that we are hearing from the teenagers who we are trying to serve and prop up to have a long, healthy, drug-free life. So what are they saying to us that they love? And what are we seeing them light up about? What are they excited to share? Paying attention to those moments, and they're fleeting sometimes. It's not necessarily something that somebody typed out on a survey, but looking for the things that cause that spark in the eye of the people that you serve, that's really so meaningful. We started off with just the idea that, hey, drug testing could be an out for some people. And then it became, well, let's make it positive. And then it became, well, how about if we have the teenagers come up with it? So let's add on some student officers. And then we added on, we really need to add some support for the parents. How can we evolve that? And then we added on, we need a structured education component. So now we've got these 5 strategies that all work in concert as one program. Being willing to accept change, even in the face of success, saying, how can I make a change to be even more impactful with our mission, not just our bottom line, but our mission, that's where you're going to find your best change.
You mentioned the resources of support for parents, but we haven't really heard about that yet. What kind of support or services do you offer the parents as well?
It's really a few different perspectives. Once a student takes their test, if their test shows that there's a substance in there, then we reach out to parents directly. The first phone call is from the doctor who analyzes the sample itself. So they have that medical conversation first. Then they get a follow-up phone call from our school counselor on staff just to answer any questions. It's usually within a few days after things have settled in and maybe their minds are whirling at the time that they're speaking with the doctor. And now maybe we need some help just thinking about what are my next steps. And then we have a collaboration with St. Elizabeth Healthcare in Northern Kentucky area. Any parent of a member in drug-free clubs, after they get a positive drug screen, they can call this substance use disorder professional that's on their staff. And they can just ask questions. Nothing is documented. There's no file that's opened. It is just a resource for parents when they're in this vulnerable moment. So they can ask what they need to ask to move forward. That's if there's a positive drug screen. When we look at the rest of the students who are in the program, we want two things. We want the parents to be informed, so they're very comfortable having ongoing discussions with their children about substances, what their expectations are. Also being able to reach out to their own family members when we alert them of a high overdose alert in a certain area, things along those lines. So all kinds of education and information. But then also we have one line of programming where it's called Take 5. And they are specific moments within our program year where we prompt parents to have that dialogue with their student. Research shows us if we just have that ongoing talk, that teenagers are about half as likely to ever face addiction if we just continue to have ongoing conversations between the child and the parent. It sounds great on paper, but in practice, it's really hard as a parent to bring up to your teenager the topic of substances. But with drug-free clubs, let's say it's the day that we're doing our club registrations. The students are in school. They get called down. They say, okay, go ahead and head to the locker rooms or to such and such a hallway. It is drug-free clubs registration day. So they go back there, they sign in, they take a survey, they take their picture for their photo ID card. When they're heading back there, a lot of our schools will do motivational things, speaking to positivity. They'll have balloons on the doorways. They'll have Post-it notes from teachers along the hallways, the walls saying, congratulations, we're proud of you, great job, all of these things. Sometimes music is playing. There's always goodies. So the students go through our registration process. While they're entering their information in our computers, that prompts an email to mom and dad saying, or guardian saying, hey, your student is being tested right now for drug-free clubs. Talk to them tonight about their experience. Ask them who was there. Role play with them using this excuse on a Friday night if they're offered something, saying, I get tested. So it's not just talk to your child about drugs. This is the perfect moment. This is a way that you can start the conversation. Always end by telling them you're proud of them. Recognize them for this tough decision that may seem easy to you, but it's extremely hard for them. So I think there's about 6 or 7 times throughout the program year that we have targeted moments like that for the parents to support them in having those ongoing conversations. So those are the 3 ways: the resources for a positive drug screen, the information and knowledge that they need, and then those prompted moments to build that parent-child dialogue.
Sounds comprehensive. Yeah.
We try, but again, to your previous point, it's things that have just added over the years. Mm-hmm. If we were a 3-year or 4-year, 5-year organization, we could never have all this. It's just things you learn school year after school year and building it up, taking advantage of things that work and getting rid of things that don't work.
Yes, getting rid of is something we sometimes don't think of. Yes. Now, what about the businesses in that they provide the discounts, the perks to the club members? How does it work? How do you approach, engage? How do you work out the deals with the businesses in the community?
You asked a great question. This is a new topic for us as well in an aspect that rewards have been around since the day we opened our doors 20 years ago. However, we're addressing it differently. And literally just last night, I got the interface for our mobile app update that is in the stages of being approved in the Apple Store. So we've had a mobile app for several years. We have on the mobile app, we have a map of the businesses where students can go to get their positive reinforcement, to get their rewards. And then we also have a digital ID card because we're talking about teenagers. I have a 16-year-old myself. We lose things. So the digital ID can be generated on a moment's notice, and they can show that ID card to businesses who offer to maybe give a free appetizer when you buy a drink or when you buy a meal, things like that. Those traditionally have been arranged by the schools. We are in about 60 schools right now, with a lot more coming on board next year with a new partnership. We couldn't possibly, being from Cincinnati, Ohio, we're a massive staff of 4. So we're a staff of 4. So we couldn't go out to all these communities and get these businesses, nor should we. We need to remain focused on keeping individuals engaged in their own community. That is most appropriate. So we give them all the tools, the templates, the scripts, the forms, the emails, everything, but they use their own connections and their own knowledge of who traditionally in their community participates. Now, that's the way that we've done it forever. There's a new piece coming on. We just received funding from 2 sponsors that made it possible. One is Dads on Duty, which is a really unique organization in California where there's some dads that have a presence in the school just to kind of even out the male-female ratio of role models for students. And then one is Big Idea Marketing Group. Together, they gave us money where we were able to work with an existing bank of coupons, rewards, all kinds of stuff that now when a student opens their Drug-Free Club's mobile app and they go to their national rewards button, there are thousands of rewards all over the country. Any community they go to, anywhere they go on vacation, there's discounts for travel itself, let alone once they arrive to a destination. You mentioned the conference coming up in St. Pete. If I were going there and I'm a member, or even this is going to be for the coordinators, the school coordinators at the schools as well, the teachers. So they could go to these conferences, they can pull up their app and get discounts at all kinds of restaurants and entertainment and hotels and stuff all in those areas. So that is brand new, not even rolled out yet, but it's about to.
Ooh, all right, listeners, y'all are hearing about it first.
It is very first. I'm always nervous to say it because it's not fully completed yet, but it's happening.
It's in the it's out there in the universe now, so it's happening. Yes.
It's in the Apple Store, more importantly.
The universe, the Apple Store, same difference.
Thing.
Right. I hear elements of being a transformational leader. You talk about the students, but then the layers of leadership that are embedded in the ripples you're creating through the communities, the school coordinators as well. And so I'm curious, what are some of those leadership lessons that you've learned over the past 20 years? How do you do that?
I have realized my own ADHD, so I have to keep myself in check when it comes to those kinds of things. It's important to not be fleeting with the projects that you launch. So take a moment. The flip side of having ADHD is I also really dig into and research things before I decide to move forward with them. What is the foundation that says we should do this? What is the promise of success if we go down this route? What is the expense that could be on the horizon and is the initial startup cost? All of these kinds of things that we need to think about for sustainability reasons, as well as continuity for the people that we serve. When you think about the fact that we have over 7,000 students in the club right now, and that promises to escalate significantly, it's not like you can get the word out there all that quickly. You can push it out there, but you got to make sure things are pretty able to be relied upon. That's why our core strategies, they don't really go away. They might
Mm-hmm.
evolve, like I just explained with our rewards. But even with choosing to do this national reward, I had to sit down and think about, okay, if this is X dollar expense each year, how do I make that possible? So really making sure that we can handle it operationally. When we started to scale, it was a big lesson to try to figure out, what do we need inside of my office? What do we need inside of each of our communities? And what do I need on my board to support me with my decision making? So having those resources to know, okay, everything on paper says it's elite, it's worth it, we should do it. But then even if you want to do something, if you feel like you're forcing the issue and trying to make it look successful when everything is saying it might not be, bring in some people that know more than you on those topics and listen to them from a third-party perspective.
Mm.
Always seek out people who are professionals in the fields that you're meaning to have an impact, and then make a decision that you can stick with.
I like it. And that was 20 years of wisdom condensed down quite a bit. I know there's a lot more leadership lessons in there, but we'll save that for part 2, future podcast. I do kind of want to hear more. You teased us with the new national rewards and the app update, but what do y'all see as that longer term vision for Drug-Free Clubs of America? Or how do you see it adapting to different drug trends or societal attitudes towards prevention or substance use?
One of the beautiful things about this strategy is that it does not address just one drug trend. Our drug trend is that we are building a greater drug-free youth, period, regardless of what the substance is, regardless of the topic du jour. It really just focuses on that belief set of staying drug-free for the sake of staying drug-free, for your own future as a teenager, for your health, for what you're building. These teenagers, if you think about what you went through in high school, you were enduring 8 hours of sitting in a desk all day, tests, homework, thinking, what do I do with college or career and all of these things? And then this one thing can undo all of that. So when we focus on just a substance, well, what if that isn't the substance that tempts them? What if we're focusing on marijuana when really it's an overstressed student who is trying to do Adderall to keep up with their curriculum? You know, so we don't focus on a specific substance. We educate on each of the substances, but we focus on that belief set of staying drug-free for your own work future, for your own health, for your brain, for the influence that you have on the sphere of people around you. So we don't follow drug trends so much as inform people about them. What was the other part of your question that you asked?
Yeah, more about like societal perceptions related to prevention or substance use.
Perceptions in society can be a challenge, right? So if you think about prevention in the past, it hasn't always been the coolest kids on campus that are touting, I want to be drug-free, right? Sometimes it is, but sometimes it's not. We need a way to make sure that the students who are engaged are there because they want to be and because they find some commonality with the other people who are in that space. That's where you start to see camaraderie. You start to see the influence from one student to another. That core is really the future of where any drug prevention program, I believe, should be aspiring to, is having the youth influence each other. I don't need, as Drug-Free Clubs of America executive director, I don't need to be the person that's influencing you to stay drug-free. I need to support the teenagers in influencing each other to stay drug-free. Because if we can do that, 9 out of 10 of our addicted adults started using in their teen years some type of addictive substance. If we can keep those teenagers free of addiction, we have a greater drug-free adult population in America. So that is really the future, is focusing on how can we best equip our teenagers to influence each other to make those healthy, productive choices to stay drug-free.
Environmental prevention. You're shaping the culture. You're creating a culture of prevention, a culture of health. And I imagine too, we could really dig in and map out various protective factors that y'all are speaking to and addressing, like community, belonging, purpose. Yeah.
There's if you go through the 40 assets and you go through all the research, there are a great number of them that the approach hits and feeds, and sort of some of the spin-off that happens from it as well. If you think about familial dynamics and the way that families are bolstered through this, where an older student wants to be a role model for a younger sibling that's coming in. We've seen that over and over again. We get testimonials about it. My older brother was in drug-free clubs. I love that I can finally do it. You know, all of those things where we use the influence that age group has on each other in a positive way so that we all benefit in the long term.
It's a beautiful, beautiful thing y'all have built and what y'all are doing for the world.
Thank you.
How could our listeners either, advocate for this approach or want to start this program or a similar program?
We are fully scalable. We identified our scalable model in 2010. We studied it until 2014, and we've been expanding ever since then. So if you are a parent or a business owner, a school administrator, a teacher, a counselor, and you want something that is positive and impactful and timely related to prevention in your school, we are it. And we've got 20 years of experience in working inside of the school district. So we are not going to make your school day cumbersome. We don't weigh things down. It feeds itself nicely into the existing culture. The great thing is that since drug-free clubs does not give test results to the schools focus on positive reinforcement for their students inside of the school environment. So the positivity that exudes from this in a school culture, you can feel it. You can feel it when you have reward day, things like that. So if you are interested in positive school culture, if you are trying to build PBIS strategies, we fit that perfectly. If there's anything that we can help you with, if you have something similar and you need some guidance on it, we're here for that too. So reach out, ask questions. We've got a counselor on staff. We've got decades of experience. We're happy to help. But then also, if you are a business and you know that drug-free clubs is in your community, it really does mean a great deal for those students to be able to come there because they might be with their friends. So they get to have a conversation about, why did I get this free appetizer or this free soda? They might be with their family where they get 10% off or 20% off. And they're like, this is great. I get this off the bill. I'm so proud of you, so-and-so, for doing this. It's something as small as a drink to that establishment. And it's a huge moment for those teenagers. So not just with drug-free clubs, but if your community has a prevention program where they are looking for businesses to engage in ways that are more than just writing a check, think in your heart if you're able to do that, because you are the ones that can build your own drug-free workforce. You are the ones that build our leadership of tomorrow, and that's inside of the schools as well as the communities. The families can't do it by themselves.
Take all of us, because prevention is better together.
It's true. It's not easy. Collaborations are messy. It's hard work. But I believe wholeheartedly in the power of the people who are doing bits and pieces of things to make a cumulative impact. Let's just work together and make this happen. If you think of a way that you can contribute, we probably have a platform for that to happen. So reach out.
Yes, and I've got 2 questions left that I want to get to. So the first one, what has been the most rewarding part of this journey for you?
100%. It is the way that the program shows me back the change that it's making. So oftentimes from where I sit and the things that I do, there's a lot of work going out. But then when you see moments where a teenager is influencing another teenager in a positive direction, when there's a new business that comes to help with something when they probably would never have been engaged in drug prevention before, when there's a school that has for decades said, we will never drug test, we will never drug test, we will never drug test. Well, nobody approached them with drug testing in the right way. They just thought about it from a mandatory, heavy-handed, punitive perspective. When they listen and they change their minds, they see the difference that can be made with it. Those are the things that they just fill my heart, because you can see all of this is worth it. It's working.
Well done. Handled that question like a pro. And so now this last one, though. This last one's a fun one.
Oh, no.
If you could sum up what you hope Drug-Free Clubs of America achieves in one sentence, what would it be?
Drug-free youth.
Easy peasy.
Easy peasy. Drug-free youth. I want the day where my 16-year-old doesn't have to worry about being able to go out on a Friday night because she doesn't know what she's going to be approached with. I want an opportunity for teenagers to have the full capacity of their brains when they reach their 20s and when they reach their 30s, and not to have lost capacity in some way, shape, or form, for people not to face addiction because somebody took advantage of them and preyed upon them when they were teenagers. And now that they're adults, they are missing out on a life or a health that could have been theirs because somebody was greedy or gave them bad information. So I know it sounds simplified, drug-free youth, but it's all of those things when you look at the bigger picture.
I can't thank you enough for taking time to chat with me today, and last time when we met to record as well.
It was fun.
Absolutely fun. And like I mentioned a little bit earlier, there's a lot of wisdom in those 20 years that I hope to capture and share with the world, because you are doing amazing things, changing lives, not just with the youth. But I just think about the parents, the families, the schools, the business owners, the ripples and conversations that you're starting, you're inspiring, and how those conversations are going to change this world. So thank you for doing what you do, and keep on rocking.
Thank you so much, Dave. It's been a really great conversation. You are very insightful in the way that you see things from a sort of arm's length perspective, and key in on certain topics that I haven't been asked before. So I've really enjoyed this time with you. And even in our last conversation where we chatted so much we couldn't even record anything, I look forward to any of the relationships and conversations that we have in the future. I really appreciate it.
Absolutely. More to come, because prevention is better together. That wraps up this episode of the Pathways to Prevention podcast. Big thank you again to Angie for sharing your wisdom and powerful story in the work that y'all are doing at Drug-Free Clubs of America. And I got to tell you, listeners, Angie's passion for prevention and her commitment to celebrating positive choices really reminds us all the importance of proactive solutions in the fight against substance misuse. If today's conversation resonated with you, I can't encourage you enough to learn more about Drug-Free Clubs of America and explore how their approach might inspire action in your own community. Check out the show notes for the links. Thank you for joining us on this journey to uncover pathways that lead to prevention. Till next time, I'm Dave Closson, and this is the Pathways to Prevention podcast. Stay safe, stay inspired, and keep on making a difference.
Thank you for joining us on this episode of Pathways to Prevention, brought to you by the Drug-Free America Foundation. Together, we're building a future where communities thrive and individuals live free from the burden of substance misuse. If you found this conversation valuable, don't forget to subscribe and share it with others who care about making a difference. Your support helps us reach even more listeners around the world. To stay connected and explore more resources, visit us online at dfaf.org. Let's continue to spark conversations, drive change, and create pathways to a healthier, drug-free future. Until next time, thank you for listening and for being part of this mission.